Is my child at risk for amblyopia? Even if on eye examination, he is discovered to have amblyopia, what do I do? Please find out. What is amblyopia? Amblyopia, often known as lazy eye, is a condition of poor eyesight that typically affects only one eye but less frequently both. It occurs when there is a breakdown in the interaction between the brain and the eyes, and the brain is unable to recognize the sight coming from only one eye. The weaker eye's vision gets impaired as the brain begins to rely more and more on the other, stronger eye. The term, lazy eye, refers to how the stronger eye performs better. However, those who have amblyopia cannot regulate how their eyes function and are not lazy. Amblyopia, the most prevalent cause of visual loss in children, begins in childhood. It affects up to 3 out of every 100 kids. The good news is that early intervention frequently prevents long-term visual issues and works well. What signs and symptoms indicate amblyopia? Amblyopia symptoms might be difficult to identify. Children who suffer from amblyopia may have impaired depth perception, making it difficult for them to gauge how close or far an object is. Parents may also observe the following indicators that their child is having trouble seeing clearly: squinting, closing one eye, cocking their head. Frequently, amblyopia is not recognized by parents until a doctor identifies it during an eye exam. For this reason, it's crucial that all children receive a vision screening at least once between the ages of 3 and 5. Is my kid susceptible to amblyopia? Amblyopia affects some children at birth while it affects others later in infancy. A child is more likely to have amblyopia if they were born premature, were born smaller than usual, have a history of amblyopia, juvenile cataracts, or other eye disorders in your family, or possess developmental impairments. Why does amblyopia occur? The cause of amblyopia is frequently unknown to medical professionals. But occasionally, a different vision issue can cause amblyopia. In order to see, the brain typically needs nerve signals from both eyes. However, the brain might make an effort to compensate if an eye problem makes the vision in one eye worse. It begins to rely only on the stronger eye and switch off signals from the weaker eye. Amblyopia may result from a number of eye disorders, including refractive errors such as astigmatism, nearsightedness, and farsightedness. Usually, correcting these issues is simply with glasses or contacts. The brain may begin to rely more on the eye with better vision if they are not corrected, though. Strabismus. The eyes typically move in unison when moving, but the eyes don't line up in children with strabismus. One eye may float upward, downward, in, or out. Cataract. As a result, the eye's natural crystalline lens becomes cloudy and appears to be blurry. Even while older adults tend to develop cataracts more frequently, newborns and children can also get them. How will the doctor examine my child for amblyopia? The doctor will check for amblyopia in your child as part of a routine vision examination. Children between the ages of 3 and 5 should have their vision examined at least once. What is amblyopia treatment? If amblyopia is caused by a refractive error, the doctor might start by first correcting the refractive error. For children who are far-sighted or nearsighted, doctors may advise glasses, contacts, then surgery for children with cataracts. The brain must then be retrained to use the weaker eye by receiving signals from it. It gets stronger the more the brain uses it. Treatments include the stronger eye being covered with an eye patch. The brain must utilize the weaker eye to observe, so the stronger eye is covered with an eye patch. Others may need to wear the patch constantly, while some children simply need to wear it for 2 hours each day. Using cycloplegic eye drops paralyzes the ciliary muscles in the stronger eye. An eye drop such as atropine can briefly obstruct near vision, which pushes the brain to utilize the opposite eye, and can be administered once daily. Some parents prefer the use of this treatment, which they find easier than using an eye patch. Simply because some younger children tend to pull off eye patches. Within a few weeks of starting the treatment, your child's vision may begin to improve. The best results, though, probably won't be seen for several months. Your children may then continue to require these treatments on occasion to prevent the recurrence of amblyopia. Early treatment of amblyopic children is crucial, the earlier the better. Without therapy, children may develop lifelong eyesight issues. Treatment for amblyopia is typically less successful in adults than in youngsters. If you have found this video useful, please subscribe and like the video. Thank you.